been providing interpreters via other locations throughout the pandemic, but we welcome Paula to the Northern Territory and thank her. And I will now provide today's update. We have 286 new cases in the 24-hour reporting period to 8 p.m. And of those tests, we had 238 were for rapid antigen tests and 48 were from PCR tests in that 24 hours. The total active cases in the Northern Territory is stable at about 3,900 cases in the Territory. We've now had a couple of days of lower numbers in the Northern Territory in that 200 to 300 range, and that's seeing our rolling 7-day average coming down to under 400. We do acknowledge that usually earlier in the week we do see a bit of a lag in testing because of the weekend. We also are seeing bumpy results in our testing because of the isolated conditions we live in the Northern Territory, the remoteness. So we are using those rapid tests, but in some situations clinical decisions are being made to use PCR tests, particularly for people that are already in isolation. So those numbers will come through in batches, so just to provide a bit of information. But we've certainly flattened the curve and we need to keep doing so that we can manage COVID in the Northern Territory. In terms of our hospital numbers, this has increased. We've got 78 Territorians in hospital, and I'll provide a little bit of breakdown around those numbers. We've got 8 receiving oxygen and 4 are in the intensive care unit. 31 are in the Alice Springs Hospital, 2 are in ICU and 2 on oxygen in Alice Springs, 2 in Katherine, 7 in Tennant Creek, 1 in Nhulunbuy Hospital who is receiving oxygen, I understand, and 38 in Royal Darwin Hospital, 2 are in ICU and 5 are on oxygen. And Dr Marco can talk a little bit more around the hospitalisation. So that is an increase up to 78 cases in the Northern Territory's hospitals. I'll just run through the regional areas of the Northern Territory. I know that many Territorians watch these updates and they want specific information to their area. I'll start off in Central Australia. We've seen 2 new cases in the town camps in Alice Springs. We have seen 7 new cases at the Alice Springs Correctional Centre, and so we have put extra resources into the prison. That total there is 89. We do have high vaccination amongst the prisoners, but we're certainly making sure they've got the resources to test and isolate people within that facility as best we can. I'd also just like to take a moment to update the Alice Springs community on a change in testing. This was provided over the weekend by NT Health, but just to let people know, the Traeger Park drive-through clinic has been stood down and we're providing all of the testing in Alice Springs out of the Pandemic Coordination Centre, which is on Bath Street. And this was an operational decision made by Health. We've seen that real up use of RAT tests in the Territory and it allows us to provide our health resources where they need to be. So an operational decision to change that. But that facility is open from 7 a.m. to 7 p.m, 7 days a week, and we'll continue to monitor. You have seen testing at the Todd facility, then Traeger Park. We've had the Pandemic Coordination Centre for a few weeks now, so that's just an update to people in Central Australia who need to get RAT tests or get tested. We've got 10 new cases at Yuendamu, but we have seen low testing numbers there. We really need people to come forward in Yuendamu and be tested. Please don't be scared. Our teams will look after you if you do test positive, but for a community of that size, we need much higher testing numbers so we can ascertain the true story there. We've had 2 cases at nearby Yuendamu over this reporting period. There's a number of communities in Central Australia where we had no cases in this 24-hour reporting period, but we do, of course, remind residents that they need to follow those public health measures and orders that are in place. We've got 2 new cases at Amungana and 1 new case at Hermannsburg, bringing the total there to 35 cases. The Barclay work camp is concerning for us. We've got 12 new cases, bringing that total to 66. And the Centre for Disease Control is working with corrections to ensure that the COVID management plan, everything is in place. I must acknowledge that there is a 100% vaccination rate at that facility. People need to be vaccinated to be eligible to be placed at the Barclay work camp. So we've got a 100% vaccination rate, but it is concerning. We've got 12 new cases. We've got 1 new case in Utopia, bringing that total to 30 cases. But we have seen weather impacting access for testing, so we'll continue to work with the local community. The lockdown continues at Utopia, And again, we need the community to come forward to get vaccinated. We've got a very low vaccination rate of 42% in Utopia. Coming further north in the Territory, in the Big Rivers region, we've got a number of cases in Pine Creek. We've got 2 new cases in Pine Creek, as well as 5 at the nearby Kyebrook community. So we have done significant testing, and that will continue today in that community around Pine Creek. So I think there's 11 cases in total in Pine Creek, so clearly a cluster there. In East Arnhem, we've got 1 new case on Groote Island, and that's at Aliangoola. At Yirrkala and Nhulunbuy, there's 3 new cases in total. And in Ski Beach, we've got a number of cases. We've got 19 new cases in Ski Beach, bringing the total to 24. But that is what we expected. We put that community into lockdown, and we did that testing on Saturday. Those decisions were made. So we thank everyone in that community that's come forward. I think there's been a very high rate of testing at Ski Beach. Gallawinku, the outbreak there has grown by 2 cases to 87, but we've been very much focused on caring for the positive cases. So the testing will continue today. We've seen a number of people already move to the Centre for National Resilience. There was a little bit of reluctance in the community first up to leave the island, but we've seen people now willing to come through to the Centre for National Resilience. We've got a remote area management plan, so we've spoken about this throughout the pandemic. Every community in the Territory has a remote area management plan specific to that community, and we've enacted that across the Territory, but for the first time we're bringing in AUSMAT to help us at Gallawinku. And so this is really important, provides additional resources, so we acknowledge the National Critical Care and Trauma Response Centre, but it also allows us to test these plans. AUSMAT did work early in the pandemic, travelling to remote communities, looking at what they would do if we did need to operationalise them. So we have enacted that and we'll work NT Health, MeWatch and AUSMAT out at Gallawinku. And we've got to focus on transferring more people off the island. They've been prioritising them in the need of care. So that will continue. Those individuals and families will come into the Centre for National Resilience. The Tiwi Islands, we've got 1 more case at Warramunga, but we've got, concerningly, 3 more cases at Milakarpiti. So we had 3 cases yesterday, we've had 3, and just as we came downstairs to provide this update, we were alerted to 12 more cases at Milakarpiti. So this information's just come to hand. So for the residents of Milakarpiti, we will go and work with our health professionals, and we'll make sure we put out a statement and information through the clinic and social media on what measures we put in place at Milakarpiti. So people, if they're feeling unwell, please go to the clinic, call the clinic, get yourself tested, but clearly a concerning number there. Milakarpiti has an incredibly high vaccination rate, 98% double dosed and 51% triple vaccinated. So that is amazing, and that is a credit to the people of Milakarpiti. So we will take all of that into account as we make our decisions. But those case numbers, those 12 I just mentioned, they're outside this reporting period. They've just come through this morning. And so we had 3 yesterday, 3 in the 24 hours to 8 p.m. last night, and then 12 more. We have got a case at Maningrida, so a large community, but that case is someone that recently returned to Maningrida from Darwin, as I understand, and the health teams, Malala, the health service there, quickly responded. They isolated that individual and the contacts, so we'll work through that. So just 1 case in Maningrida, and so we'll certainly make sure that they are cared for and that we isolate any potential contacts. There's 3 new cases at the Darwin prison. And then the other cases of note in the top end are at the Baton Road facility, and there's been some cases provided over the weekend, and there's been a lot of work that's been undertaken, and I spoke about this on Saturday. 115 close contacts have moved from Baton Road to the Centre for National Resilience. We have PCR'd every resident that is still at the Baton Road facility. We've got 35 confirmed cases at Baton Road that have also been moved to the Centre for National Resilience. And so with that testing that's been undertaken, we expect more cases to come through, but we're working very closely with the NGO at that facility. And it's also raised with us, the incident management team is now contacting the NGOs mainly that run these high-risk type facilities, so sobering up shelter, for example, transitional housing, those types of facilities where you have large numbers of people housed together. So we're working through with those NGOs. If they need any resources in the short term, we're happy through NTG to supply those, and we're just making sure that the COVID management plans will respond. As we learn through each situation that arises throughout the pandemic, we then need to put that practical overlay into those plans. So a little bit of information there about Baton Road. It's certainly well in hand there, but also working with our NGOs around a number of other settings to make sure everything is in place. So over the weekend, as I mentioned in the opening comments I made, we saw our testing numbers drop down a little, but our teams are working extraordinarily hard across the Northern Territory, and we're seeing the impact of the wet season, and that's another factor for them to contend with. So we expect over the coming days those testing numbers to come through and additional cases. It's not too late to get vaccinated. That's my clear message for Territorians. Please get vaccinated, first, second or third dose. It's not too late. We don't ask those questions about why you've perhaps waited. There's appointments available. Parents are starting and carers back to school. There's vaccine appointments available across the Northern Territory. In terms of hospitalisation, there's always a lag from the positive case numbers, and we saw those very high numbers last week. There's always that lag, so we expect the hospitalisation numbers to rise, and Dr Marco will talk to that. We've got 450 people at the Centre for National Resilience, either close contacts or people that have COVID. And we've got around 150 people at the Todd facility in Alice Springs. We're seeing people transferred. They go to hospital for assessment. They're transferred to CNR and Todd facility. But we're also going to see people transferred from Todd facility up to the Centre for National Resilience. Howard Springs, it's a world-class facility. It's got everything set up to care for people. And so we will bring people up to that facility where we've got the bed capacity, and then we'll make sure they get back to their community. And so in organising that, we've been speaking to Emergency Management Australia, Joe Buffone and the team there, and the Australian Defence Force is going to help us with some logistics of planes over the next 48 hours to help get people mainly from Alice Springs to Darwin, and then also from Gallawinku into Darwin, so just to help us shift those higher numbers of people. So I'd like to acknowledge Greg Hunt and the Commonwealth Government for their support. We just want to make sure that we've got the bed capacity where we need it if we see numbers come up in Central Australia. We've got, as I said, 450 people at Centre for National Resilience, and we've got the capacity for hundreds more there. So we also are working towards a longer-term transportation solution that we'll have in place territory-wide. It's just that the Howard Springs facility is in the top end. It's a great facility. As I said, it's got the capacity there to care for people safely in an appropriate setting. So we're just making sure we've got the flow through to get individuals there. So our rolling 7-day average is starting to drop, as I mentioned. The public health measures that we have in place, so the masks, people being vaccinated, checking in, and those lockouts and lockdowns, they are impacting. They've helped us flatten that curve. So again, just reiterating, the vaccine is vital, particularly those booster doses. If people have been away and returning to the Territory, make sure you get that appointment, and also those 5 to 11-year-olds. So just to recap, there's no changes yet. We've got the lockdown for Gallawinku, Ski Beach and Warrimiyunga. The lockouts continue to be in place for Yuendamu, Yuelamu, Alice Springs and Amungana, and we've got the lockdown for Utopia, so we'll make sure there's clear information if there's any changes to that. I'll hand to Dr Marco, and then we're both happy to take any questions. Thank you.
Thank you, Minister. So I'd like to reassure Territorians that we are seeing a steady decline in the number of cases of COVID-19 over the last few days, which is reassuring. However, we are seeing incursion of cases in more and more remote communities and affecting high-risk settings. So we're watching closely and working very hard with communities and with partners to ensure that we are prepared to better manage those incursions in our remote communities and high-risk settings. With regards to remote communities, our main aim when COVID goes to your community is to try to identify it early and to try to reduce the spread. Avoid that the COVID goes from house to house and across the community or to nearby communities. We really want to partner up with community members, community leaders and organizations to find the best way in your community for us to achieve that goal. The goal is to slow down the spread so we can identify cases and we can manage those cases and provide them with the care they need. If we need to support them for isolation and quarantine, we will work together with you to do so. If you need to be transported outside of your region to achieve so safely, we will be able to do it in small numbers. We want to make sure that everyone is safe and receiving the care they need closer to home. In the instance of East Arnhem, where I got a lot of history and a lot of connection and care for the place, we are working very hard with our partners in Galiwinku, in Elcho Island, with MeWatch Health, with ARCS, with other government and non-government agencies to make sure that we are finding ways to slow down the spread in Galiwinku, to provide the care to residents when they need it, and to assist them in coming to Darwin or elsewhere to receive the care that they need. We're also working very hard in Uelemu and Yundemu. We're also working with the Tiwi Islands now with the increasing number of cases there, and in Utopia. I'd like to talk about hospitalizations, and we are seeing an increase in hospitalization in recent times, which is also steady. And we normally see that when the number of cases start to slow down, hospitalizations keep going up for a number of weeks, because we see that hospital care tends to present late in the disease, and we are expecting this rise in hospitalizations. Also, as I mentioned before, we see now more COVID affecting indigenous Territorians, affecting people in high-risk settings, and those individuals tend to have a higher need for hospital care. So at the moment, we got 78 patients in our hospital, which is now at 2% of the total number of active cases. And many of these cases are receiving care in our hospitals for a variety of reasons in addition to COVID. Only 8 of them are requiring oxygen, which is what we call severe COVID, which is about 10% of patients requiring hospitalizations. And we got now 4 patients in intensive care. One of these patients is receiving care in the ICU solely for COVID, and the other 3 have other reasons why they are in ICU in addition to COVID. We've seen in the ICU an overrepresentation of unvaccinated people. Of our 4 patients in ICU, 2 are unvaccinated and 2 are fully vaccinated for a 50% split. However, we know that in the Northern Territory, we have a 95% of our population fully vaccinated, and that small 5% of population that is not fully vaccinated are overrepresented in getting very sick and requiring ICU care. I'd like to emphasize to Territorians the importance of not to lower our guard. As I said before, this is not a mild disease. It's just a less severe illness that we've seen with other strains of COVID, and it's very important to maintain a high level of alertness to help us and help our communities to slow down the spread so we can manage those individuals that get a bit sick and require extra care, and our hospitals are not overwhelmed and our health services can provide with the care they need. Thank you.
Thank you. Happy to take any questions.
You mentioned OSMAT are being deployed to Galiwinku. Can you tell us exactly what kind of resources that they are providing?
Yeah, so OSMAT, as I mentioned earlier on in the pandemic, they worked with us and they actually visited a number of communities between Alice Springs and Darwin, looking at what their resources could do if we were to see an outbreak. And so we have now worked with them to deploy them over to Galiwinku, and so they very much have an approach where they work in partnership with MeWatch, the Aboriginal health organisation there, and the NTG officials on the ground. It's extra hands on deck, it's extra resources, and it's important for us. The Galiwinku situation is under control, and it's important to go out and test these practically whilst we have a managed situation in case we were to see more severity of illness or numbers increase, not only in Galiwinku but in another community.
Yesterday, Anne was talking about that they're very concerned about the situation in Galiwinku and talked about the need for something like a temporary isolation facility in communities. Is that something that OSMAT could help with? Is that became a need? Is that something the government's considering? Yeah,
so OSMAT, we know they have a number of physical resources that they can also deploy along with their people, but we do have the Howard Springs Centre for National Resilience, so we've got plenty of bed capacity there, and as I have pointed to, we've also got the ability, and we're working on extending that. There has been a number of people that have already been evacuated off Galiwinku into Darwin, and there was significant work undertaken over the weekend in getting people, and obviously people that are unwell or had other underlying issues, we focused on them. So we have transported a number of people into Darwin, and that work will continue.
You mentioned earlier that there were some bumpy test results because of isolated conditions. Do you believe that we are catching all of the cases out there?
I think that what I was trying to indicate is that it's patchy, it's lumpy, so we have days where there's lower test results coming through, positive test results, and other days they're higher. We see that around the weekend, and we've utilised clinically the decisions being made in a couple of situations, Pine Creek, for example, and Milakarpiti, to do PCR tests. It's a more efficient process on the ground to go through. So what we'll see is some of those results start to come back through the labs, and so you may see, like you've just seen, that 12 cases that we've just been advised of for Milakarpiti. So people need to, once they've had a test, they need to isolate whilst they're waiting for that test result. And again, if anyone is unwell, they have symptoms, they should isolate and reach out to be tested.
We've had one Walfree community leader say that positive cases haven't been isolated because they haven't understood why it's important to do so because of language barriers. What's the government doing to support in language health advice for positive cases?
So the Northern Territory Government works in partnership with the land councils, the Aboriginal medical organisations, as well as community organisations that are on the ground in these communities right across the Northern Territory. So we've got 80 remote clinics spread across our communities. So we certainly have got structures not only within health but also broadly within Northern Territory Government to ensure that all the information is disseminated and that people have what they need, particularly in language.
You mentioned that the Vaccination facility, there were some concerns raised about the availability of supplies for NGOs. What is the NT government prepared to deploy to NGOs if they are in a similar situation to the Vaccination?
Yeah, so we've got the incident management team, and they're set up under the emergency banner within NT Police, and so they're contacting those high-risk type settings that I just explained to see that their COVID plans are up to date, and if there's any resources. So, for example, one comes to mind is the rapid antigen test. They've certainly, in terms of their ability, has increased the sensitivity during the pandemic, so they are a tool that over the last few months has become very relevant. So making sure that they're embedded in plans, what the process is, and if they need any resources, NTG can certainly provide them in the short term, whilst they may, source those commercial supplies for the longer term.
Another resident at that Vaccination facility said that there was not culturally appropriate communication, there was no communication in language. Is that also something that needs to be considered when the NT government is trying to work with NGOs in high-risk environments?
Yeah, we'll certainly take that feedback on board, and we do have the Aboriginal Interpreter Service that provides a resource, so we'll certainly ensure that any feedback from residents, that they understand what is happening as these types of situations happen potentially again.
Going back to the weather effects of the territory,
yep.
Residents in Utopia said they're concerned that rained out roads will further isolate residents in the midst of their outbreak, and obviously there's been some concern about the accessibility of food as well. What's the government doing to address the concerns about accessibility?
Yeah, so with the lockdown that we placed in Utopia, we were very conscious that there was a number of community locations, and even though they needed to be locked down to stop the spread, they still needed to access supplies. So we certainly took that into account in that decision making, and we will work with the community around ensuring that that the supplies are getting through, but also that there's staff available to deliver them or make sure that the store's open, for example.
Just more generally, we've had reports from the ground in remote communities across Central Australia that the government's response is changing rapidly in reaction to dwindling space, quarantine facilities and staff availability. Does the government concede that things aren't going to plan in remote communities?
I strongly disagree with that comment. We're managing this. We have flattened the curve of COVID in the Northern Territory. I've just been explaining the resources. We've been very forthcoming in terms of the numbers. We have the Todd facility, which supports the Alice Springs Hospital. We have the Centre for National Resilience, which has plenty of capacity. We've just outlined how we are, as we've seen the increase in case numbers, how we're transferring people to facilities to ensure that they get the appropriate care. And also remembering that people can stay in community, and we are seeing that. A large number of residents don't want to leave their community. They want to stay where they are, and if they have a very mild illness and we can care for them, that's also appropriate.
Dr. Marco mentioned there were 78 hospital cases at the moment. That's 2% of all active cases. According to the NT Health modelling, it should only be 1% of cases. Has the government underestimated how vulnerable Territorians are to Omicron?
Dr. Marco might like to speak further, but before I hand to him, we have seen the case numbers rise, and then you see that lag with the hospitalisations. We've got these people, they are in hospital, they do have COVID, so we've been very upfront with those figures. We've been providing the numbers in ICU, but as well the people receiving oxygen. A large number of these people have other health issues and illnesses that are also being cared for. So in terms of the hospitalisations, we're comfortable with where things are at, but it's certainly in terms of our resources, we're planning and making sure that we have those quarantine facilities interacting and that there's the bed availability so people can, if clinically safe, move across to the quarantine facilities. I'll just hand back to Dr. Marco.
Yeah, thank you. Just to expand on the hospitalisation matter. So 78 currently in hospital, of which 52 are in hospital for COVID-related matters that cannot be cared for outside of the hospital setting, which is 66% of those 78, and that is a hospitalization rate of 1.3%. We have factored in the burden of disease in the Northern Territory and also all the social determinants of health in our modelling. We are expecting to see higher hospitalization rates than we see in other jurisdictions based on our demographics and some of the logistical matters. We have said before, have been working arduously to find alternative ways to provide that extra care that Territorians need, but that does not need to be in hospital occupying some of our acute care resources.
We know that 50% of people in ICU are vaccinated, but are you able to tell us yet what that number is for overall hospital admissions?
I don't have the breakdown of all the hospital admissions. As I said before, the fluctuation of admissions and discharges makes very difficult to give up-to-date data. We're seeing a similar split between vaccinated and unvaccinated, but remember that there is an over-representation of unvaccinated people, as they're only 5% of the population and are between half and three-quarters of our admissions in hospital and 50% of the ICU admissions today.
We've heard that modelling suggests that we might see the peak of cases in early February. Do we have any modelling that suggests when we'll see the peak of hospitalisations?
It's normally a week or two after we see the peak in cases, we see the peak of hospitalizations. When we see a flat curve like the one we see in the Northern Territory at the moment, that hospitalization peak probably will follow a similar pattern.
Today we've seen the start of the federal government's concession RAT scheme for concession card holders. Obviously there's a lot of concern about the availability of RAT tests. Will concession card holders be able to get their free tests from government facilities, so that those pandemic coordination centres?
Yeah, so the Northern Territory Government, we've managed our rapid antigen test supplies very well, and that work will continue. So anyone that clinically needs to get a RAT test, and I've said this many times, they're available. We don't need people to run out and to hoard them. They'll be available if you need to use those tests, and then we'll work with the Commonwealth Government around this program to ensure that those tests are available to people that do need to have them on hand as we move forward. In terms of managing COVID, it is good to identify it early, or for people if they're feeling unwell to know that it's not COVID and they can get about their lives. So we'll see those commercial suppliers, from what I understand, in the coming weeks, that there'll certainly be many more available commercially, but Territorians should be reassured that we've got a steady supply of those tests and they're available if and when Territorians need them.
So just clarify, so it might not be for strictly clinical reasons, but will concession card holders be able to get the tests from those facilities, from the distribution centres?
So from the Northern Territory Government distribution centres, people need to clinically have a reason to access those tests, and so that is if they have symptoms or if they've been deemed as a close contact. But what I'm saying is that Territorians shouldn't panic. There is a steady supply right across the Northern Territory. We're seeing those supplies replenished on a regular basis. The tests need to be kept under 30 degrees, which can be a challenge at times, so people shouldn't feel the need to run out and stockpile themselves. They're available if you need them. And if you've got any type of symptom or illness, you should be isolating yourself, and then you can reach out to get that test and identify if it's COVID or not.
The NT's come last for the 13th time in the Comsec report. What's your reaction to that?
So the Northern Territory, we've done a lot of work rebuilding the economy, and we certainly have got strong plans in place as we step forward. There's a number of projects that are starting to come to fruition. So we certainly focus on the activity that's happening here in the Territory, not looking at reports that are developed interstate.
We've got this lovely Auslan interpreter. Are we going to see more culturally appropriate and diverse translation services for health messaging?
So we've worked throughout the pandemic to ensure that not only is there translation available, but it's also culturally appropriate messaging. So we have done a lot of work, and I'd like to acknowledge the Minister for Territory Families, Minister Kate Warden, who's done a lot of work to get an Auslan interpreter and to also make sure that there's pathways for future Auslan interpreters. But again, multicultural, those culturally and linguistically diverse backgrounds will certainly always work to ensure that health information is available in the most appropriate form.
We've heard that the peak is expected to hit in the early weeks of February. That's also the start of school. Children's vaccinations for under 11s have only just started. Are we ready to reopen based off how many kids have got their vaccine?
Yes, so we opened up our program a fortnight ago, and we've seen thousands of Territory kids aged 5 to 11 receive their vaccination, and it's certainly, from the parents and carers that I speak to, it's the top of their back to school list. So there is appointments available. I had a look this morning out of interest. There's appointments available in Darwin today. So don't delay. Vaccination is vital. Children are very used to receiving their vaccinations. There's a strong Australian immunisation program that all kids receive, and the COVID vaccine is particularly at the moment really important. I know Territory parents are anxious about kids returning to the classroom, but we need our kids to head back in for face-to-face learning. It will be a disrupted semester, I do anticipate, but we certainly have put in place strong plans. The Department of Education is working closely with the Department of Health to ensure that a range of measures are in place to ensure the safety of our children and also, importantly, our teachers and other school staff. So vaccination is important, and I know Territory kids are certainly looking forward to heading back next week.
Is there any consideration of setting a percentage threshold of vaccinated kids in that younger cohort before reopening?
So in the 5 to 11 age bracket, we have approximately 24,500 Territory kids in that age grouping, we believe, and we had the availability of around 24,000 vaccines. So there's no reason why every Territory kid cannot receive the vaccination before they go into the classroom ahead of the school year returning.
That's fine.
Queensland has shown the gap between boosters from 4 months to, I believe, 3 months. Is there any consideration that the Territory will follow suit?
Yeah, so we've seen a change in the guidelines from AHPPC nationally around the boosters. We've seen that reduced, and we've seen other jurisdictions that are got significant numbers. I'll just see if Dr. Marco wants to add something there.
Yeah, thank you, Minister. I don't have anything to add. We are considering adapting the new intervals for the booster vaccinations and reinforcements.
I think we're all done. Thank you very much.